Bonding dentists together is what we do at Dentist Job Connect. And we're so excited to share with you a group that is doing amazing things out there in this dentisting world. My name is Paul, Dr. Nacho Goodman, founder of Dentist Job Connect and Dental Nachos. And I'm so excited to talk with my guests today. I will let them introduce themselves and tell us what they do to help dentists survive, thrive, and most of all, not cry.
All right, Dr. Goodman, good to see you. Thank you for having us. Excited to spend a few minutes today with you and your audience. Just a little introduction. My name is Humam Ali, and I'm with Reveal Dental Partners. We're a neuro dental organization that's been around for about 18 months. I've been around dentistry for a little over 18 years. I was a trained dentist overseas, and then I joined a few organizations. And over the last couple of years, I partnered with a healthcare investor, and we decided to build something unique and special to support dentists and really help them do what they love, especially if it's in the field of dental implant placement. So, Reveal Dental Partners is a support organization supporting those that have a passion for the dental implant treatment and they want to grow their businesses. We have a partnership model, we have a de novo model, and our goal is to support dentists create more reveals. And that's how we came up with the name.
I like it. Expansion reveal. Thanks for sharing with me, Oman.
No, my pleasure. And now I'll hand it off to my business partner here.
Yeah, so thanks again for having us. Dustin Nettrell, I'm the COO for Reveal. Prior to us partnering with Reveal, I had started up Brightly Dentures and Implant Studios alongside of our partner doctors. And we grew that organization to 7 locations. And then, Humam and I met not long ago and said, why aren't we working together here?
Yeah.
So we're both on the same mission there. But I've been in dentistry now close to 8 years. But I actually started my career in consumer electronics appliance industry, and then also e-commerce, and then behavioral healthcare. And so, kind of what I've learned along the way is how do we operate at scale? I had 228 stores in 20 states, doing 2.4 billion in revenue. How do you acquire people online, through digital marketing? I had an e-commerce business deploying about 170 million in spend annually. And then how do you work in a clinical environment in behavioral healthcare? Um, and what I quickly realized is I'm merely a muggle in the world of dentistry, right? So my job is really to carry the bags, to do some of the heavy lifting and the non-clinical things. And so my role is really to support our doctors and to make sure that we have good patient flow, our bills are paid, our facilities look good, we have the right supplies, the right people to support our partner doctors.
Awesome. That's great. You have bring a lot of experience to the table. My next question, you gave us a little bit of an overview here, but if we talk about like championship teams, like, oh, I don't know, the Philadelphia Eagles and their Super Bowl victory here, you guys have a team at Reveal. Tell us about how many practices are part of the Reveal group.
Reveal has, as of now, 10 locations spread out in 6 states. We're about to enter our seventh state in just a few weeks. And we also have two full scope labs, one in Florida and one in Arizona. And we're also proud that we have our own dental implant training institute in Charlotte, North Carolina, one of the proudest partnerships we've had with the Engel Institute.
Awesome. He's great. I just, saw him at an event. We co MC'd and Todd is just an awesome dentist and human himself. So if we take these 10 locations and we're out there in my community, how many are looking to hire currently, or do you have a pulse on how many positions you're looking to fill?
Yeah, so I'll take that. So we're currently we within the Brightly locations that we brought on, we have 7 locations. We're actually looking to bring on 7 general dentists in order to support those locations because we're focused on denture and implant related work, but we want to broaden the amount of services that we provide to our patients. We want to really become their dental home. So
Right?
they may come to us for dentures or implants, but how are we going to take care of them afterwards? And are there other things that they need that don't involve the removal and replacement of teeth? We want to be able to round out those services, but also give that general dentist the ability to receive mentorship from someone that can do all on four. They do
Yeah.
zygo, pterygoid, stuff like that. So we really view this as a win-win opportunity for the right associate.
I love that. And as someone who we run a two office group in New Jersey, and we have a surgical prosthodontist, and we have some specialists, and we have a lot of general dentistry. It's just really cool to be in a place where cool things are being done, from fundamental restorative dentistry all the way up to helping people replace all of their teeth. So I love that. Now, if we talk about what you're looking for in an associate dentist, if we're building this associate dentist to fill these general dentist positions, kind of tell me what you're looking for, whether it's clinical skill set, whether it's past experience. Tell us about that.
Yeah, we're looking for individuals that can do crown and bridge work. They're not afraid to step in and help out if we need some hygiene work done. We will build out our hygiene department and bring in a hygienist, but they may need to do, the occasional SRP or whatever it may be. But then also helping us with evaluating patients for different procedures. So as people come in and they schedule a consultation, being able to do a consult, whether or not they're the one that's going to end up doing the work, we're not sure. But they need to be able to speak to what an all-on-four is and how that
Yeah,
works. They also may need to be able to learn how to do some of the restorative work as well, because our primary partner doctors are quite busy, and so being able to have a an associate that can do the restorative and do the pros work actually is a really good way for them to enter the field of implant dentistry, because now
sure.
they have a real appreciation for starting with the end in mind. Any doc can probably place an implant and not kill someone, but can they do it in a way in which they actually understand what the VDO is going to look like? Where is that abutment going to end up versus the screw channel? How am I going to attach teeth to this? And so we think if they start out on the pro side, that will make them a better implant dentist down the road.
I like that. Dustin, you're like an honorary dentist with all these dental terms. So you really are tuned in
Well,
to this.
don't
So
call me a doctor.
at Dentist Job Connect, we have, associates at all different ages and stages, looking for their first job, looking for their fifth job, looking to partner. So kind of talk to me next about ownership potential and mentorship. Tell me what that looks like inside of the group. Associate said, I'd like to learn more about this, but I'm interested in potentially owning part of the practice one day. And I also would like some mentorship. Kind of talk to me about those 2 points.
Yeah, I'll
Yeah,
let Humam take that.
Yeah, I love that question because as we put together the thesis of both Reveal and all the great things that the Brightly team was doing, we named the organization Reveal Dental Partners because we want to create a network of doctor partners that are like-minded and all share similar interests and passions. So now, obviously, not everybody starts as a partner, but we want to work with them to put them on a path to partnership, should that be a desire of theirs. In terms of mentorship, one of the main reasons we're excited about the partnership we have with the Engel Institute is to provide this hands-on learning opportunity with live surgeries, live cases that really can elevate the doctor's skill set. In addition, they're going to be working side by side by very well experienced implantologists in the practices. A lot of our dentists, as Dustin mentioned, not only perform the all-on-X procedure very fluently, but also do advanced procedures like zygomatics and pterygoids. So as an associate, you're going to have first row view of all of this. And we're actually proud to share that a lot of our doctors are already mentors at organizations. So mentorship and partnership is definitely part of our values, and it's definitely things that we want to extend to all the associates that join us.
I love that. I mean, that a spirit of guiding the next generation of dentists, showing people things they didn't know existed. That's what I'm proud of in my own office, whether it's the patient, the team members, the associate dentist. It's cool when you have a group like this. I'm known for saying that there are three M's that matter most to associate dentists: mentorship, money, and morale. And you guys have done a great job outlining what Reveal Dental Partners does. But as we kind of look at this image about some of the details, because I don't know if you know Dustin and Human, and you're technically a dentist, Human. Dentists love details. They love the details inside of the details, right? So kind of just walk me through a little bit about the compensation, things that they can expect, anything we might not have hit on. If somebody's listening and got to this point and say, I'm just about to text Brightly to 215-798-9897 to apply. I'm just about to go on Dentist Job Connect and apply, but I have a question a little bit about compensation or anything else. Tell us a little bit about this image here.
Yeah, happy to take that. So, our traditional partner doctor makes quite a bit more than what we have up here on the screen, so you can see that there with Golden Valley. But um, 200 to 500,000 a year is quite attainable. So it's a mixture of a daily guarantee plus compensation based on applied collections. And what's different about us than maybe some or other organizations is we make sure that the compensation is very clear to where you can go and you can run a report in Dentrix Ascend and you can apply the percentage and you know what you're going to get paid. There's
Love
no
that.
like, oh, I got you for the lab fee. Oh, I got you for the cost of collections, or there's some other hidden fee that they deduct before they do the math and everything. So people get enamored with, oh, I get paid 32% of what? That's the question you should
Yeah.
always ask. And so with us, while our percentage may be a little lower, it is a very straightforward number that anyone can do the math and there's no ambiguity. And the reality is, I've never been able to cash a percentage at the check, but I have been able to cash dollars. And
Yes,
so
exactly.
our compensation target for an associate doctor is 2 to 500,000 a year. And then in our Golden Valley location, we're actually looking for someone to step into more of a lead role. And that individual can make 3 to 800,000 a year, depends on their skill set and what they bring. But what I can tell you is traditionally our partner doctors are making north of 700 a year.
That's amazing. I know the power of the patient-centered and profitability of implant dentistry. And I am a huge implant fan. I know you're doing more than just implants, but when you can change people's lives, do things in an efficient way, you can be patient-centered and productive, which is the name of the game. So I want to share with my audience who's watching in. If you want to learn more, please text Reveal to 215-798-9897 so we can connect you with this awesome group. Dustin and Human, thank you for sharing. Is there anything you would like to share before we wrap up? Anything else?
Dustin.
Uma? Oh, he's trying to pass the buck to me. But
Yeah.
what I would just
Well,
say,
I'll share after you
go
do.
ahead.
You can both share. It's
All right.
one share per person. That sounds
It's just a big sharing circle here.
yeah.
So I would just say that, for our organization, we are looking at, a pathway of growth, so as we think about, mentorship and being able to advance and grow your skills, we have a very handsome CE reimbursement program for our associates, mentorship, but then also the ability to, hey, I want to go open my own location because we're not only just a partnership model, but also a de novo model. We'll go build you a location. You
Nice.
decide, hey, I want to go and retire in, Green Bay, Wisconsin. As long as we can make the math make sense around like, is there demand? Is there the market? All of that, we'll open you there. We're not necessarily tied up on geography. We're more concerned about, do we have the right people? Do we have the right amount of demand in the area? And can we build a winning team around that doctor? But we're very comfortable building a practice around anybody that joins the team.
Love that.
Yeah, no, well said, Dustin. And I'll just keep it simple. If you're passionate about implant dentistry and making changes in people's lives and joining an organization that not only believes in that, but wants to, enhance that with everybody's skill set, let's talk.
Awesome. Absolutely love what you guys have shared. Thank you so much for partnering with us at Dentist Job Connect. We're excited to find you guys some associates. Enjoy the rest of your day.
Thank you, Dr.
Thank you.
Goodman.